Oh, snap!
The world is finally waking up to the crap that's baked into and sprayed on kibble dog food. No longer can commercial pet food manufacturers fool us with pretty pictures and false promises. This is the raw dog food truth. The view and opinions expressed on this podcast are not intended to replace medical advice. Before starting any raw diet, do research, ask lots of questions, and consult your vet.
Well, hello, raw feeders. I'm Dee Dee Mercer-Moffett, CEO of Raw Dog Food and Company, where your pet's health is our business. And we're friends like my friend, Dr. Judy Jasek out in Tennessee. She is fighting a good fight, trying to keep your dogs healthy. Good morning, Dr. Jasek.
Good morning from hot and humid Tennessee.
Right? It's good for your skin. That's all I
It
got to
is.
say.
It is. It doesn't. I do not have dry skin except for my feet because I wear sandals all the time, and I got like ground in dirt in my feet. Just I can't even get it out. I was like, yeah, whatever. I'm a homestead girl now. I can have dirty feet.
That's all right. That's all right. You're grounding. You're grounding all the time, right? Got your feet in the dirt and feeling the earth and around in the trees. And you and I listened to all these different podcasts, and I was listening to, and I think it was on the way forward. I don't know if you heard this one, the lady that talked about the Bach flowers and talking to the trees and talking to the plants and
I think
all
I
that
did.
kind of
I
stuff.
did see her. Yep.
Yeah. So whenever I deadhead, I deadhead my plants, you pull I still put them up to my face and I breathe them in, smell them, and I have Lozzie smell them. She tries to eat them, which I find, eat them if you want to eat them, because they're not, they're not poisonous. But yeah. So I
we
love
need to
that.
spend time. We just need to spend time around nature. I think we'd all be healthier. I think our pets need that. Get out in like real nature, not artificial glyphosate sprayed parks nature, out in the real trees and in the water and all of that stuff. It's important. It's important for us and important for our pets. And it's so simple and it doesn't cost anything. People get concerned about the cost of health. And, even for people, they say you just spend a few minutes in the, early morning light, I was listening to another guy in a podcast that he said, like 10 minutes of doing like Qigong or yoga or something in the early morning light, just and breathing. Oh yeah. As a breath work guy, he was talking about different ways of breathing and breath work. And he said, just become aware of your breath, just focus on your breath, be aware of your breath for 10 minutes, do some stretches in the early morning light, and it will reset your day. Well, you could do the same thing with your pets. I mean, they stretch naturally, they get up and they stretch, and get them outside and move around with them, in the morning. And they say morning and evening are important. That's the best time to go now anyway, because it's cool.
Right. Right. I want to talk a little bit about the earth, a little bit about the ground. I was talking about this a little bit before the podcast because, Dr. Jasek, I've heard this in regards to parvo. I've heard people say, well, it's in the soil. It meaning a virus. Now, you and I, we're probably not going to agree with that. And here's what I would like to see. If there were puppies that were getting what looks like parvo, right? Ataxia, can't hold down water, they're vomiting, diarrhea, that sort of thing. The first question I would ask is, has this dog been vaccinated with a parvo shot, right? And if we actually looked at what a parvo shot is pushing into a young puppy, that should scare the bejesus out of you, right? But people can do it. You can do sort of crazy things when you think it is protecting someone or something or some pet, right? That's why you can do it, because you're like, it doesn't matter that these are all really toxic chemicals that are in this thing that I'm putting in a young puppy, because it's going to protect him. Okay. That's a tough one to break. But I would contend this. If you have puppies that are not vaccinated, right? And they're in said area and they get what looks like parvo, Instead of looking at it and going, oh, that's a virus, this invisible thing that nobody's ever isolated and can't identify, I would say let's look at the soil. What herbicide, glyphosates, pesticides are in the soil? And then if we can't find anything there, then I would say what is in the food of which that puppy is eating, right? A lot of people feeding that puppy chow and that sort of thing. What's in that? And then then the next control study I would do is if all of those are negative, right? Then I would look at what is in the mama of which that puppy is sucking on the teat. Is that dog, what? Because nobody's doing that work. They're just like, oh, well, this is parvo, so let's give them another shot, another dose. And so you and I were talking about that there's glyphosates. There's glyphosates every freaking where,
Yeah.
and I don't know if that's it or not.
Stays in the soil for long periods of time.
Yeah. But I just can't, that narrative is so strong. And I think when we see these puppies suffer like they do, we can't seem to stop doing that thing that might be
Right.
a disadvantage.
The real tragedy is we're not getting to the root cause because we're just saying, oh, must be parvo, but then we're not looking at what could really be poisoning the puppies. And if you think about, like, you and I don't buy into the whole virus narrative, but even if you did, I mean, viruses supposedly live inside cells and damage cells and kill cells.
Right.
How on earth is that virus going to live in the soil for years? Like, if you really believe that viruses exist, that doesn't even make any sense. And I've heard that, oh, viruses or parvos are really, strong virus. It can live in the soil for months or years. That just doesn't even make any sense, that it just survives out there in the soil. Viruses, if you buy into the whole traditional virology thing, they live inside the cells. They're intracellular organisms. So how on earth are they going to live out there in the soil? It doesn't even make any sense. And the puppies, as we were talking about, puppies die even after a couple of shots. So if they're getting parvo anyway, after a couple of shots, well, I guess it means what? We just give them more shots from the conventional perspective.
Well, and what's crazy to me, Dr. Jasek, is then the puppy's dying. They're like, see, had parvo. And you're like, is it possible? Okay. Is it possible that we put something in them that helped accelerate their death? That's the question, right? And you and I have looked at the FOIA request from Christine Massey, and specifically on parvo, and said health agencies have said, no, we can't give you that direct report that says it's a direct, that we found this virus called parvo. So we don't have that information for you. So it's like, well, how did it come to be then? If we don't have that information that has parvo, that we actually have an injection for it.
Right. Exactly. And I'd like to, the other thing I'd like to figure out too is this testing, because it's all based on the fact that they do this parvo test, which is like a little spot test, it's kind of like a pregnancy test, but test for parvo. So if there's no virus, like, what is it testing for? And I bought some tests and I've tried a few different things, like, so the classic is because you supposedly test the poop. So I, but there's almost always with parvo, there's almost always blood in the poop. So, I mean, I've tested my blood, I've tested my dog's blood, I've tested my dog's poop. I can't remember if I tested my poop or not, but I did test the dog's poop. But I'm trying to figure out, so, Jamie Andrews, who we're going to have on the podcast to talk about this, like this myth of contagion, and that, he's done these controls to further prove that these supposedly virus identification studies are a bunch of BS. He told the story of like some high school kids taking COVID tests and putting Coca-Cola on them to get out of going to school. So he said, look, mom, got a positive COVID test, can't go to school, so they figured out a workaround. So what is it? What's in that test? Now, something I want to ask him is, like, is there a way to, how do you figure out what is making that dot turn blue, because that's all it is. It's just a, it's a color change. It's a little test with 3 dots, and you mix the poop with some reagent, and then you pour it on the little test, and you have 1 dot turns blue. That's your control. 1 dot is your negative control. It doesn't turn blue. And then your sample, supposedly it either stays clear or turns blue. So, but if there's no parvovirus, then what is that testing? Because if we can invalidate the testing, I mean, that's another thing that's huge, because that's what it's all based on. Well, they tested positive for parvo, but what are they actually testing for? So that's another rabbit hole investigation.
Well, and we know, we're not saying that that there aren't puppies that are not getting sick. There are some,
Oh,
right?
absolutely. I've seen
But-
many of them.
Yeah, but the question would be, what are the variables? What is the
Mm.
food? What is the water? What is the soil? Has anything been put in the puppy prior to, right? So what are all of the shots that go into a puppy? And do you know what the ages are, or do they vary? Let's say if you have a breeder, okay, that follows the standard protocol, right? What's that going to be? Is that going to be the influenza, the parvo, what all are those puppy
Well,
shots?
the standard puppy shot, they refer to like the DHPP. That's
Okay.
distemper, hepatitis, parainfluenza, and parvo. So that's kind of the basic, but then there's variations on that. So sometimes they add in lepto, sometimes they add in, there is actually a coronavirus that supposedly affects the intestines in dogs, but it's supposed to be really mild. But sometimes they throw in that into the vaccines as well. And then they might do Bordetella, which is a separate vaccine. But the very basic, like say a breeder is going to be vaccinating, it's usually that DHPP. Now, what I would suggest if I had clients that just couldn't get past the vaccine, really wanted to do the vaccine, I would do monovalent, where, okay, let's just do the parvo. So there's only one thing in that vaccine. I don't think any vaccines are safe. So I really would probably change that recommendation these days. And when I talk to clients that are getting new puppies, I just recommend avoiding vaccines. Sadly, most puppies have had vaccines before people get them, because most breeders won't release puppies unless you've got a natural rearing breeder. And a lot of people, they get rescue dogs, and it's really sad because you can't go to a rescue without getting a dog that's been vaccinated up the wazoo and had all the heartworm prevention and flea and tick. They're so toxic. But if I talk to people about like, well, at least let's just do what appears to be a more minimal vaccination, so maybe they're not getting as much stuff. But that's the typical. And you can go, like some breeders, I mean, you can go to like Tractor Supply and buy. I actually had a client that told me they went to Tractor Supply and saw a 9-way vaccine. I think it had like all the different leptos in it. So you can go buy vaccines over the counter. And I think some breeders do that just to save money, take them to the vet. They just do their shots, and it's not required. I have clients say that, oh, their breeder says they're required by law to do these puppy shots. That's a bunch of bunk. They just say that because they want to do it, and that's kind of what's expected in the general pet world, is that the puppy is coming to them with certain shots. And when I got Rex, I asked the breeder, I have a little bit of an edge because I'm a vet. I said, I'm a veterinarian and I would really just like to do my own protocols. Would you release him without any vaccines? And they said, if you're a vet, this was a small breeder, so if you're a vet, we're okay with that. But I've had clients ask that question and it didn't happen. They take the whole litter into the vet. It's just, they just end up giving it to all of them. But I was reassured when I went to go pick him up, and I said, so this is just for people that if you're trying to get a puppy that's unvaccinated, be really careful, because a lot of times you can ask that, they say yes, and then they do it anyway. But when I picked up Rex, I asked, I said, has he had any kind of vaccination or examination or anything. Is anybody like listen to his heart or anything like that? And they said, oh no, it was just easier to not take him to the vet at all because you weren't getting the shots. And I'm like, yes, like perfect. I'll just
Right.
take the puppy. And then she said, well, we haven't been letting him out in the yard, or anything too much because he hasn't had his shots yet. So I felt pretty safe that he hadn't had shots, but those are important things, to ask if you want to get a puppy that doesn't have vaccinations, check into those things with the breeder. But yeah, not only, and they're not getting just the parvo, they're getting these multiple components. And sometimes they start really young, like 5-6 weeks, and they're just hammering their immune system. And, to your point of what's the mama getting? Well, just imagine you've got a little, what about like maybe 4 or 5 week old puppy? They just weigh a couple pounds. And then you give mama a flea and tick preventative, which is a neurotoxin that's going in the milk. And the puppies are getting all those toxins. And another thing I think happens too, because I saw a lot of what, when I was first starting out, what we called parvo. I mean, I did the testing. We used to test puppies, they test positive, and we treat them. And in my experience, the really key was keeping them hydrated. So because they can't hold down water and they're just vomiting and diarrhea just really profusely. And that was really important. And I've seen puppies, they don't hear about parvo diagnoses too terribly often in our like kind of more urban or suburban pets. But when they do, and they go in, the list of drugs that these puppies get when they're hospitalized, I mean, they're given appetite stimulants and antiemetics, which stop the vomiting, and probably 2 or 3 different antibiotics. I honestly think they kill them with the treatment sometimes. I think if they just supported them with fluids, I mean, I used to use homeopathy and things like that just based on their symptoms. The majority of the puppies, like I'd say 85-90% recovered. But I've seen some go in for treatment with these parvo symptoms that didn't survive the treatment. I'm like, what's up with that? Because these were, relatively healthy puppies going in, and even some that were unvaccinated. And then I look at the list of drugs that these puppies got. I'm like, well, no wonder they didn't make it. They're killing them with the treatment. Like, where have we heard that before, right?
Yeah, and so Jamie Andrews, who's going to come on the podcast, and if folks want to listen to him, he's already out there. He's been on The Way Forward with Alex Zek. I think he's been on Terrain Theory podcast as well. And what he is doing, and it's open sourced, he's doing it so everybody can watch, is he's going through testing and doing actual control studies, right? Where if you look at said testing today on certain things, there's really no control, right? There's no, this is a clean petri dish of no virus, right? Because there's supposedly, Dr. Jasek, a bank, right? That you can get certain, right, cultures, is that right?
Cell lines, yeah.
Cell lines, which they say are free from said virus. And then people are saying, well, that cell line had a virus in it. That's how, that this cytopathic, breakdown is happening. And I thought it was brilliant what Jamie said. He's like, well, you just kind of, blew your whole theory. If in fact, all of these cell lines that are supposedly free of a virus are infected with a virus, that means every test that you've done out
there, it invalidates all the future testing,
right? Which I thought was brilliant. So he wants everybody to be able to see this, right? And what is the one that he's working on right now? Which is it? Is it which virus is he doing the control study on? Do we know?
I'm not sure, because it sounds like you might be doing multiple things simultaneously. I mean, I know he's looked at, on the human side, he's looked at measles and HIV, I think maybe polio, and found like things that look just like what they consider to be the particular virus. Like this is what a measles virus looks like. Well, he's found those exact same things just looking at the the cell lines processed in the way that they do when they're testing for a virus. So they process these cell lines and then they add like blood or saliva or whatever body fluid they're testing, snot or whatever in there. And then they look for these things and they call them the virus. Well, he's finding these same things in just those cell lines without adding in any bodily fluid. So he's like, these things existed before. I sent him pictures of what's on the CDC website for the rabies virus. They're supposed to be these like bullet shaped, and just seeing, or say if you ever see anything that looks like this, that would be really interesting evidence to debunk the existence of the rabies virus.
And I think that what he has said to you in your conversation, and he will be on, I think it's July, let's see, it will be at the end of July or first of August.
I think it's in 2 weeks. Yeah.
Yeah.
I think it's the last Tuesday in July.
But what's interesting is he says the work that we're doing right now is something that you can take and apply to any said virus. Okay. Right. And this is what gives you the information to understand whether there really is one or not. Right now, do I think that every person is going to be open to this? I don't, because we see this in just talking about prescription diets. Okay. Or kibble. We tell people all the time, if your dog is having diarrhea, if your cat is having diarrhea, if they're vomiting, if they're, having problems, you got to remove the cakes, cookies, and the toxins. And that is what we call kibble, right? There's no possible way, if you look at the ingredients, you understand how it's made, that any animal would be healthy or better off eating that. Dr. Jasek, are you better off eating a steak or chips and salsa?
Well, chips and salsa are pretty tasty.
They are good.
Healthier eating the steak. Yeah, I don't do well at all on any kind of carbs.
Yeah.
I'm a carnivore. I like to eat the meat.
Yeah, me too. And the meat and the fat and the organs and all that kind of jazz. One of the things that my husband does for organs is when he does his absolute pure protein with eggs and raw cow's milk and that sort of thing, is he takes the desecrated organs and he opens up the capsule, so he doesn't eat the capsule, the thing that's around, but he opens up the organs and he just puts it in that, and he's able to get that. Now, a lot of people can take their organs, in a capsule form if they so choose. But yeah, the one thing that we don't get a whole lot of is organs.
Yeah.
But anyway, back to Jamie, which I think is going to be very interesting, is that he wants this control and this information to be out there, open, and I believe he's on X and showing that stuff, and I'm not sure where all, but we're going to get all that information for you guys so you can kind of follow along. If you choose not to look at the research, that's fine, but I don't think you can argue, Dr. Jasek. I don't think you can make a case unless you've at least looked at the research. You want to look at the research and have an argument against it, that's fine. You can have an intelligent conversation. But I don't think you can have an intelligent conversation as a medical professional if you will not look at said research. Like I remember the Bigglesons talking about that this doctor from Tufts University. Where have we heard Tufts before? Anyway,
yeah, right. It's such a reputable institution, right?
Man, and so in the live blood analysis, right, where you're seeing the energy field and you're seeing the pictures in the blood and you're seeing the somatids and you're seeing all this kind of stuff, this doctor wouldn't even look. He was like, I'm not even going to look in there, because think about it. If you have a narrative, if you have a belief, if you have a protocol that you don't want to deviate from, you don't allow anything else to come in your head, to come in your peripheral, right? It's like,
totally. And for, those of you that, really don't want to vaccinate for things like, especially rabies is the most heavily mandated because there's laws around it. And that's one of the fallbacks that the vets use. Well, there's a law and somehow they have deputized themselves to be the vaccine enforcers, which is a bunch of BS. But if you want that sort of thing changing, I'm actually looking into avenues to pursue that here in Tennessee and gaining support and resources. And one of the things that I was told this weekend is that you can't just go to like the legislature and present like this information. They've never heard it before. That'd just be like, whatever. They want to know what their constituents think. So the lady I was talking to said, if you want to get the laws changed, because if you really want to make, because the vets aren't going to change, I'm convinced of that. I mean, we've encouraged people to push back, and one or two people coming in their clinic and pushing back, they're just like, crazy person, go someplace else. But if we can change the laws, then the vets have nothing to stand on. And I think that's where we need to be going. And it takes action, and it takes lots of people to take action. But what I was told is that the legislatures, they want to hear from their constituents. So if you want laws changed, you need to find out what are the laws in your state, and you start writing to your congressman, find out who made those laws, because those laws are based on this false virus information. And the reason things like what Jamie's doing are so important is this is the evidence that we can ultimately present to get the laws changed, because it's counter to the previous information. So that's going to be valuable. But the congressmen, your legislatures, they want to know that the people voting for them want to see this. So this is the time, you can't just sit back and complain about this stuff, because it isn't going to change unless lots and lots of us take action. So find out what the rabies laws are, who made them, start writing, saying, we have evidence that the evidence that these laws are based on is no longer valid. Maybe start sending them some of this information. I think the podcast in 2 weeks will be very informative. And for those so inclined, donate to Jamie's work. I mean, is costs money. Each one of these cell lines is a couple $1,000s. So I've donated. I think Dee Dee's donated. I'll probably continue to donate. And it's on the way forward. It's the wayforward.com, but it's the way FWRD. It's not the whole word.com. He appeared on that podcast, and that's where the donations are filtered through. So if you donate on that website, it goes to Jamie's work. And this is like just crucial in presenting this, because the vets aren't going to change. They're so indoctrinated. That isn't going to change. We have to take another angle. And the people I've been talking to that know a lot about the legislature and how that works actually think this might be possible, but it's the process.
So the legislature, a lot of people don't even know how laws are made or who makes the laws. So the legislature are the ones, you remember when the whole COVID thing, and you had supposedly your governors coming in and making a law? They can't do that. It has to go through a process. Right. And everybody just believed that. Well, our governor said, the law was blah, blah, blah. Well, no, it never went through the actual political process, that process of who makes the laws, right? How does a law get established? How does it get passed, right? Who are those people? And so that's something that you guys want to get clear on. That will help you. And I think the other thing too, that is so important is, again, like what you said, where did it come to be that a rabies vaccine was invented? What was it based on? Right? What was the evidence? And as Christine Massey, I think, would agree, there is no documentation anywhere that would say, here's the virus, it's right here, look at it. And now if I take it pure form and I put it in this dog or even in this human, then they're going to have these symptoms of rabies. Now, you could poison them, you could shoot something in their brain. That's very different than a virus,
Yeah.
right? If you're going to foam at the mouth, or you're going to, whatever all these, rabid running around trying to kill somebody. It's like an old scary movie
It
of
is.
the werewolf,
It
right?
is. It is. And that's why, I mean, what persuades people more than anything? It's fear. And what made the rabies narrative so powerful is that it can be spread among species. Because I mean, they're now coming out and they're saying, oh, bird flu, it goes from the chickens to the cows to the cats. Well, that was never, even in like more conventional virology. I know, like when I was in vet school, viruses were always very species specific. It very rarely did they cross species lines, except for the evil rabies, because rabies, supposedly, this is what I was taught, could infect any mammal. So there was this risk if your pet's out around wildlife, or, if your dog, goes and tangles, gets sprayed by a skunk, and then maybe it got rabies. And then if it bites you or your neighbor, then your dog, well, the only way they test is the brain. So your dog actually has to be euthanized. And that whole idea of testing the brain too it's just another fear factor to get people on board with this narrative, because who wants their dog killed because it might be suspected rabies, right? None of us want our pets to die unnecessarily. But the whole idea is it's spread in the saliva during a bite, but the only way to test for it is in the brain. So the pets have to be killed. So what a powerful narrative to get people to do these vaccines, because they're like, well, if I don't get this vaccine and, I see my dog with a bat and somebody finds out about it, and then the only way they can test for rabies is killing my dog, well, they're going to go get the vaccine because they don't want their pet to die. But it's all made up, in my opinion. And we're going to keep working to prove it.
Well, and here's the thing. You can sign up for Christine Massey's FOIAs. Okay. So it's Christine, Chrisistine, Massey, Massey. Her July 11th FOIA. So it's like a Substack. Okay. But if you just look for that, you can subscribe to that. Her one that came out July 11th was Bird Flu Hoax Update. Lead agency still can't provide or cite scientific evidence of H5N1 or contagion of symptoms. And she has a lot of links in here, but, including one that says an official 2023 confession that the experts at Canadian Food Inspection Agency have zero scientific proof of the existence of any alleged virus that they claim has ever affected livestock in Canada. So she has lots and lots of links, lots of evidence, including the agencies themselves saying, I'm sorry, we don't have any evidence to provide you, but we're going to kill all these birds. But just because, we have a narrative that we got to stick to. And so this is really important. It only if, Dr. Jasek, if you want to get out from underneath the medical narrative.
Right.
If you don't, then
this like bird flu narrative, they're taking down the food supply. They're already killing millions and millions of chickens. And the way they kill them is horrific too. They just basically, they enclose them in these big chicken houses, and just in this hot weather, I think they just cut down the ventilation, let them suffocate, or they put some poisonous gas in there, and they just kill them. It's very brutal. It's very inhumane, and it's for no good reason. And Christine is going and saying, do you have any actual evidence that this exists? And it doesn't, but the narrative persists. And that's what I think is important for people to realize. We need to make that distinction between what is the real information and the true facts, and what's just a made up narrative. And this bird flu thing is just all a big made up narrative. I think personally, with a bigger agenda to attack our food supply. It's happening big time in Iowa. I listened to Dr. Lee Merritt, some of her stuff, and she lives in Iowa. And she said they've come after the chickens. They're wanting to tag and vaccinate all their beef. So that's going to be tracked and contaminated. You know, they can't get any kind of like raw milk in Iowa. She lives close to the Nebraska border. So she says, I can get it in Nebraska, but, you know, literally crossing back into Iowa, crossing the border with raw milk would be illegal. Like it'd be easier to buy fentanyl or something, to be trafficking fentanyl than raw milk. I mean, you can get so many other poisons that are illegal, but raw milk, oh my God, like don't touch that horrific stuff, right? You and I are both drinking raw milk, by the way.
Right, right.
Yeah,
It's
yeah. But
amazing.
it's just a crazy system. And so why are they doing it? They this is what I believe. They don't want us healthy. They don't want us eating these healthy foods. And they want to force us into dependency on the government where you're not going to have. What did I hear the other day? It made me just want to throw up. Oh, maggot milk. Bill Gates is putting out their maggot milk to go with your cricket burgers. It's disgusting. And if you folks don't want to be stuck eating this stuff, you got to start pushing back. It isn't going to this isn't going to go away unless we really need a revolution.
Well, come on, Dr. Jasek. It's not going to go away. They won't even pull the toxic food away from the dogs. Not
Right.
only will they not pull it away, it is, hey, we're going to put a brand name on it called prescription. There's really nothing prescription about it. It's not really very healthy at all. Actually, it's very toxic, but we're going to put it as a prescription. And then we're going to market it to every breed there is. And we're going to say these are for small dogs, little bites, big bites, because that's what people like. Forget the fact that it's toxic to your animal and cheaper.
Right. And it's recommended,
and
it's recommended by the veterinary profession. So, you know, it must be good. I mean, forget about, aside from emergencies anymore, just forget about going to the vet. Don't do wellness checks. Don't go in unless it, you know, if your pet's seriously ill or injured, take them to an emergency room and say, it's just what I'm here for. I'll deal with anything else, you know, because they're less likely to push the vaccines and stuff. It's not in their business model, right? The other vets, how they make their money is pushing all that other stuff and keeping your pet ill because then they make a lot more money. So, and I used to say this, I didn't like, it like kind of hurts my heart to say you can't trust your vet, but you can't trust your vet. And I'm in this profession almost 40 years. And it's hard to say that, but we really need we need another system. We need another parallel system. And actually, you know, kind of starting to work on that as far as a system of educating vets that are interested in going a different route. I'm working with a foundation that provides this education for humans, and they want to actually add a veterinary division. So that's really exciting for me because I don't like building websites, and well, I can't. I don't like that stuff. But to kind of you know, piggyback on what they're already doing with human practitioners and educating vets in what's actually known as anthroposophic medicine, which is a very big word developed by Rudolf Steiner. It's basically mind, body, spirit medicine. It's holistic medicine. It's the same as terrain theory, looking at, I like terrain theory a little better because it's like anthropo, yeah, like, we can't even say the word or remember the word. But you know, it's the whole animal and the whole terrain. It's this whole thing. And there's just got to be some vets out there that are looking for something different. And if we can have an educational and mentoring system where they can come in and they're supported, we can build a community. We can do case rounds where we can meet, talk about different cases, so vets have support. I really think we can begin to create that system, you know, step by step. But that's pretty exciting because I current veterinary medicine, they're lost and gone. You're not going to change them. Just use them only when you absolutely have to, you know, if it's a true emergency, for like something catastrophic. Everything else, you know, hopefully we can begin training other vets. You can do the wellness piece more naturally.
Yeah, it's you know, and I would say the younger your vet is and the less time that they have been out of med school, the more that they're going to go by the book.
Mm-hmm.
Buy the book. Here's all the pharmaceuticals that you've got to do. If you can, at least work with a vet who's been out of school 10, 15 and more years, you might stand a chance. And this is just something that I've seen in our daughters where she has worked. And you look at, even she will say, this vet has just come out of vet school. And so she is like prescribing this, too much of that, but they're very, very by the book. And we always say they haven't been out working in the real world long enough to say, why isn't that working the way that I thought it was going to work? I thought that I was going to be helping this pet by doing this, but I'm seeing that this pet's getting worse.
Right. It
Right?
took me about, I'd say it was probably 8 to 10 years where I started just saying, I don't think this is the best we can do for our pets, unless it's a vet. I had one vet work with me once. She was just awesome. But she grew up in like a holistically minded household. So like I grew up in a very conventional household. You went to the doctor, you got your pills, like a holistic medicine, natural living. That was not on, my family's radar at all, still isn't. But people that grow up in that environment are already a little bit more open to that. But I would say, yeah, as a general rule, I think that's very true. It takes a while out in the real world. And because these other skills, the herbal medicine, these other ways of treating are not taught, it takes a while for vets to come out and, and it's a trap because they come out, they're in debt. And now there's all these big corporate clinics. They offer good salaries and paid vacation. And, some of these young vets, they're starting families. They need that money and the time off. And to do this more natural route, so far you kind of got to go on your own. You can't go really get a job doing it.
And the one question that you would ask is, do you get paid on production?
No. Yeah, most do.
Do you get paid on production? What that means, guys, is they are commission based. That means that if you have emergency visits, you have surgeries, and let's say that surgery is $6,000 to $10,000, right? I was in sales my entire life. That's what I did. I sold forklifts for a long time. And it's called the gross profit margin. What do you get? You get paid on the profit margin. Okay. So if it's let's say it's a $10,000 surgery and the actual gross profit margin is $7,000, they get paid a certain percentage of that $7,000. I find in medicine that this is a conflict of interest. I find that is a terrible, terrible conflict of interest. If you get paid more money, the higher something is costing the client, that seems like maybe you might be suggesting things that the client doesn't really need.
Right. Are you going to recommend the more expensive things? And this is very commonly done in business practice management in veterinary medicine. It's called the ProSal program, where vets have a base salary and then they get like monthly or quarterly bonuses based on their production. And it's a contract, and it's exactly like what you said. It's a percentage of what they're producing for the practice, and then it naturally creates competition. The vets want to get the higher bonuses, so they're going to try to outsell their colleague and sell more things, sell the more expensive things, and prices for stuff. I mean, every time a client tells me about a surgery or something they had to go in and get, thousands and thousands and thousands of dollars. It's really gotten ridiculous that how expensive things have gotten.
Well, and nobody, when you're in, again, a sales-based environment, that means that you are rewarded for your sales. Your focus is on, I have to feed my family. I want this new car. We're getting a house, whatever you're doing in life financially. And you have an avenue to get there. And not only do you have an avenue to get there, but you are rewarded financially, you are rewarded mentally, you're high-fived by everybody. Maybe you have a team meeting and wow, so-and-so sales this month were X and Y. That means that your focus in the medical industry is not on, am I prescribing or doing the right thing for the client? That's not your focus. That's not your focus. And I think that that is very misleading to us as human beings that go into a doctor's office, as it is us as pet parents that go into a veterinary office. Are you comfortable, pet parents, taking your pet in, knowing that that clinic is based on a production? Your veterinarian is getting paid not just a salary, but they're getting paid commissions based on the protocols of which they are prescribing to your pet. Are you comfortable with that?
No, and ask, I'd like to know, because, it's always, that's, you go into a car dealership or something. I always felt that was a very valid question, is the salesman, because many of them do work on commission. Are they getting a flat salary, or are they commission based? Because if they're commission based, they might, maybe forget to mention some things about a car that you're looking at that you might turn you off, and maybe, promote some other things because they really need this sale because they got their mortgages due, that sort of thing. So I think it's a very valid question to go into a vet clinic and ask, how are your vets being paid?
Yeah. And so we have that aspect. And then we also have do you actually have the scientific evidence, right? Maybe your vet has it, but Christine Massey has never been able to obtain the actual evidence of said
Right.
virus, right? And so these are the questions, right? And I think that once you start asking those questions and finding out that that information isn't there, or you find out that the information that is there is not what you expected at all, right? You were like, wait a minute, I really thought that there was this massive information that was readily available, that all of these people that are asking for the FOIA, give me the documentation. If it was there, wouldn't you think that they would say, I'm going to shut these people up? Shut up. You are just stupid. I'm going to make you look like an idiot because here it is right here. No, what we are getting is we don't have it. How many years, Dr. Jasek, have they been administering? Let's just take one, the rabies virus. How many years? I mean, the rabies vaccine.
Oh, that's a really good question. I don't know if I can exactly find that out, but I mean, I've been practicing for 40 years and it was well known. So I would say, since probably the early 1900s. Well, Pasteur was like late 1800s. Pasteur's, I mean, he's the one that really invented the first vaccination. When I want to say like 1870s or something like that. That's really when it all started. They just changed the form over the years.
Yeah, I'll have to look that up. But yeah, Pasteur was a long time ago. So there has been ample time to get these research studies done.
Born in 1822, died in 1895. So like the mid 1800s is when this all started. And if you read, and there's a lot of books on this, it's not like we're just talking off the top of our heads. There's a lot of books that have written about Pasteur, and people that work with Pasteur have reported just how his research and what he did was just so substandard, and he was literally making patients sick by his supposed rabies treatment and rabies vaccinations. They were just they took like he tested the rabies test was injecting like some saliva from a supposed mad dog with rabies. They'd inject it into the brain of a rabbit, and if that rabbit got neurologic symptoms, it they said it had rabies. Well, you could inject saline into something's brain. You're not supposed to be injecting stuff into the brain, and they're going to have symptoms. Well, then he would take that spinal cord from that rabbit that tested, positive for rabies, grind it up, and then inject it back into the patient that had gotten the bite. Then they'd get sick from that, because you're not supposed to be injecting spinal cords into your body. And there's all this evidence that like multiple people would be bit by the same dog, same supposed mad dog, and only the people that got the treatment or the vaccine actually got sick. And this is really well documented. It still kind of baffles me how this narrative got started, but well, they must have just wanted it to get started, I guess. But it definitely took hold, and it's been very powerful ever since.
Right. And so, sorry, I'm having to hook in. My computer's about to die. That's what we want people to be aware of, right? Because if you're not aware of that, Dr. Jasek, we understand why that you would think that we're crazy and other people are crazy. But again, my point is, why you have to ask this question? Why am I willing to stick my head in the sand? Or better yet, I like to say up my sphincter. Why would I rather stick my head up my sphincter?
Yeah, because that's pretty uncomfortable. I mean, I do a lot of yoga, but that's a really tough position.
Or maybe somebody else's sphincter. I don't know, but I like my head just on my shoulders, not stuck up anything. But that's always the question. Why would I rather not know? I don't want to know. Right. And I would say that whatever question, whatever answer you come out with, think about that. Am I safe not knowing the truth? Might I do something to my pet or my kids or my family, or might I do something that, let's just say, let's take a real simple example, shall we? I'm going to get on a plane and, I could know, maybe there was a protocol that I could know whether, one of the wings is gone. Maybe I just have to open my eyes. But if I don't want to know because I need to get to said place, and that's the only plane, but it only has one wing. That wouldn't be a very smart thing to do, to get on a plane and fly out of there just because you have an agenda that you got to be somewhere. So I don't want to look, maybe that one wing plane could get to where I need to be.
Right.
I mean, that's a little bit more absurd. I mean, I'm sure I could come up with some other examples. Oh, not like the COVID vax. I wouldn't ever use that as an example. Right? I just wouldn't do it. It's just not in me. So I would ask that question on myself. What is the benefit? Because I don't want to push back, because I don't want confrontation. I don't want to think that I'm wrong. I don't want to have to do any research because I don't have time. I don't want other people to think I'm crazy.
Or I don't want to feel guilty because I've been giving these vaccines to my pet and I might be responsible for, them being sick.
So that doesn't make any sense to me. It's like, I'm just going to keep taking this poison myself. I'm just going to keep taking the poison myself because I don't want anybody to not like me. Well, they're not even going to remember you if you're not here. I mean, they may, okay, well, took the poison and now they're gone.
It's uncomfortable to change a paradigm. There's been so many things in just the last 4 or 5 years that I've changed my way of thinking on. The viruses are one of them. And it's uncomfortable to think, wow, all this stuff that I learned in school and everything, like a lot of it, most of it was probably just a lie and with a hidden agenda. I mean, that's uncomfortable to face that, but I'd still rather know the truth. I mean, my perspective, and I think Dee, you're probably the same way, no matter how uncomfortable, I want to know the truth, because then I feel like then I can make valid decisions. If you're just being lied to and you're making decisions based on a bunch of lies, you don't know what's really right for your pet or what's really making it sicker or yourself. So I would always rather know the truth.
And some people, even if they know the truth, are not going to do anything different, just like the folks who continue to feed kibble, right?
Mhm.
And I think we give ample information. And let me see what is happening here. My little, oh, you see me? I'm in slow-mo. Can you see? I'm in slow-mo on the video for some
Yeah,
reason.
you're a little glitchy. You're a little glitchy. You're a little glitchy.
Yeah, that is weird. But I would say that, what was I going to say? My glitchiness made me, hopefully this podcast is still going. If the video is not, it's fine. I don't know what's happening. Are we being heard? Dr. JC, somebody pausing us out there?
It might be somebody like, we don't like them talking about this.
Right, right.
Oh, you froze up again. Yeah.
All right. Well, we'll end it here because something's happening with our computers. But listen, we got a lot of great stuff coming your way, folks. And so you just keep listening. If you want more information, I'd reach out to Dr. Jasek at AHA. AHA is what it's actual Animal Healing Arts, but it looks like Ahavet, which is great.
Mhm. Mhm.
ahavet.com. Her team can work with you. You can find her on our experts page as well. Hit that contact button and you can sign up to work with Dr. Jasek. Get your dog on a species appropriate diet, guys. Super easy. Got to get them off the kibble. There's just no way around that, period, bar none. Brian is here to help you. Sign up for a free 20-minute consult. He'll help you get the right food, the right supplements, the right treats, the right bones. It's super easy. Just get over to rawdogfoodandco.com, where your pet's health is our business. And what, Dr. Jasek?
Friends don't live friends. Feed kibble, y'all.
That's right. We'll see you soon, everybody. Bye-bye.